Good Thursday morning and welcome back to the Livingston Parish News Morning Show. My name is McHugh David, publisher and editor of the news. Appreciate you guys joining us this morning. If you're watching us live, thanks for that. If you are listening or watching later, appreciate that as well. Of course, we upload these shows, www.livingstonparishnewscom/podcast. Appreciate you checking them out there. When you get a second, of course, if you can't catch the live show in the morning, we always upload them there, audio and video versions. Traffic this morning, looking at minor delays, as hopefully it's just essential workers heading to work or those working for businesses that are kind of in that gray area but are practicing social distancing. We'll get to that in a second. The governor did discuss that yesterday at his press conference. I don't know why I said that with such strange emphasis, but there are minor delays at 4-H Club Road, River Road, and 190 in Denham Springs, as well as minor delays at Jubin Road and 190. You're looking at pretty easy going on 64 heading into Central, and same with Greenville Springs. It's currently 68 degrees. 88 degrees is your high, 68 your overnight low. So not going to be too bad today. Looking at a pretty sunshiny day. It is going to get warm though. It's obviously going to be close to 90. So please remember that if you have to head out for essential necessary items or going to the doctor or something like that, please remember it is going to be warm outside. We're up to 1,795 cases in Louisiana. 65 deaths. 6 cases in Livingston Parish so far, and we caught up with Parish President Leighton Ricks yesterday. We'll talk to you all about that in a minute, but you're getting up to about 11,500 tests, so that's good. Tests are rolling in, number of positive results kind of going down, unfortunately, in terms of a per test rate. Unfortunately, of course, we're still getting big jumps in the number of cases, and that is really the big deal here, is not necessarily that tons and tons and tons and tons and tons of people are going to get it. You know, now it is a novel virus. That means there's definitely at this point no vaccine for it. And we don't know much about it. We don't know much about the virus except the data that we have here in Louisiana and what's come from overseas. But the problem is that health infrastructure in any given area is designed for a population. Now, we compare things to Italy a lot. We go over this just about every day, but it's worth repeating because the governor brought up some specific dates yesterday. So when we're talking about healthcare infrastructure, we're also, in the terms of coronavirus, talking about overwhelming part of that infrastructure, which is the intensive care portion. Now, there are chances and abilities to expand what's called surge that to different buildings, taking other rooms, that sort of thing. But then you remove the ability to care for people with other problems. And a lot of times, excuse me, a lot of times this virus is so virulent, it's so contagious that just bringing it into the hospital can spread it to several people. So one of the things that the governor brought up yesterday and starting to mention specific dates is that we don't have enough ventilators. A lot of these cases have to be hospitalized, which is the important number. Out of the 1,795, he said roughly 900 are in the hospital. A lot of those people have to be on ventilators. He said right now, the New Orleans healthcare system, which includes all the hospitals down there that can possibly treat ICU patients, are roughly 600 behind on ventilators. He's looking at 200 that should be coming through today, and he's hoping to get that number caught up by next week in order to avoid what I guess you can call is the coronavirus D-Day. Now, what that means is that on April 4th, they're going to run out of ventilators. If the growth continues and we do not flatten the curve, by April 4th, ventilators are going to be out. That is including some of these folks who are going to be walking out of the ICU because they are not necessarily cured, but they have gotten over the virus. Now, the virus causes a disease which is called COVID-19, and what that means is, by walking out, is that one of the things that the governor discussed yesterday as well is that in order to walk out, in order to be declared officially cured of the disease, you have to pass 2 coronavirus tests. Now, the governor flat out said, we just don't have the number of tests. We can't do that. So once you've been in the hospital a certain amount of time, usually about 8 days, if they no longer have to use any kind of drugs to keep your fever down, your pneumonia is past, that sort of thing, if you have been hospitalized, and you go about 24 hours without symptoms, they're going to let you go. And that's part of just trying to keep these folks funneled in and out of hospitals, trying to keep that infrastructure open for as long as possible. Of course, the governor has been discussing what is called surging critical infrastructure to different buildings, new buildings. They're also considering the convention center on the river. Now, all that being said, we already discussed ventilators potentially running out on April 4th. The governor said yesterday that he expects critical infrastructure for healthcare for COVID-19 cases in New Orleans to collapse on April 7th. Now, when we think about collapse, we think, Katrina, knocking buildings over. It's not necessarily what that exactly. What that means is more like Illy. That means when you start getting patients coming in and they're going to have to start making value judgments, which is not where we want to be. Because what that means is it's focused on those that you believe are the healthiest and can make it through. And you saw this happen in Italy, basically, where critical infrastructure became overwhelmed and the numbers just started to go up in terms of deaths. So April 4th, ventilators in New Orleans, April 7th, critical infrastructure. Now, you're probably asking, how does that affect Livingston Parish? Well, we caught up with Parish President Leighton Ricks. Mr. David Gray gave him a call. We talked to him for a little bit. And according to Parish President Leighton Ricks, he has been in touch with the regional director for Louisiana Department of Health, who is over this area. And one of the things that he said is that they do expect to open a testing center here. He believes that number of cases, which is currently in Livingston Parish, to go up to 6. Now, one of the things that was brought up during that press conference was that in the Baton Rouge, especially in East Baton Rouge, and in Bossier and Webster, but we'll focus on East Baton Rouge, the cases are trending upward in almost a similar number as New Orleans. They're just several days behind, about 8 days behind New Orleans. So what does that mean? Well, Baton Rouge area has less health infrastructure than New Orleans. There's, of course, less people. So what you're expecting is about 8 days later, if we can't get that federal help, which we'll talk about in just a second, you're looking at another system being pushed to the breaking point. Now, when you want to bring all that home, that is what flattening the curve means. It means trying not to overwhelm that critical infrastructure so that doctors don't have to get to this point where they have to make those value judgments. Now, of course, Parish President Leighton Ricks also said that in order to stay with the governor's mandate, he is going to keep parish offices closed through April 12th at this point. They will not reopen next week. So please keep that in mind. Also, we've discussed that court in Livingston Parish will end up moved to May for the most part. There is one court date late in April, but expect that to get moved as well. But we're not 100% sure. So don't take that for fact. Again, Ricks believes that that number will go up. So it's a potential that this could come here. We are currently just talking with healthcare providers in the area to see what kind of critical care infrastructure is available in the Livingston Parish area. Of course, one of the things Parish President Leighton Ricks is concerned about is once it gets here, he's not really sure if it comes here. Of course, he expects that they'll be opening a testing facility here. He's not entirely sure where people are going to go. They're already going to Hammond and Baton Rouge to get tested. No one is not real sure. There's not a whole lot of critical care infrastructure here in Livingston Parish. Again, still waiting for those numbers. But if Baton Rouge is already overwhelmed and Hammond is already overwhelmed, not entirely sure where we're going to go. Of course, a lot of this was discussed to have started at Mardi Gras. So if you went to Mardi Gras, if you're showing symptoms, of course, that was about a month ago now. 2 weeks after that was when the first case hit. So, and of course, it's been spread. It spread for several weeks before we started shutting things down. But please remember that overwhelming of critical infrastructure for healthcare is the reason that we are asking not we, I mean, I say we like I work for the state of Louisiana, why the state of Louisiana, why the governor, why your neighbor is asking you to stay at home and practice the appropriate social distancing methods, which is keeping 6 feet between you and others if you go out, and even within the home if you think somebody's sick. Of course, if somebody is sick, you need to stay at home. So the mitigation methods are washing your hands for 20 seconds or more, staying home, especially if you're sick, disinfect common surfaces in the home or office, 10 or less gatherings, and 6 feet apart. Now, one of the reasons we brought those mitigation efforts up and talking about disinfecting common surfaces at home or the office is yesterday someone asked the governor at his press conference about, what's the whole work thing? What's going on with employers? How does this work? The best way to interpret it is this. Number one, there are essential critical infrastructure necessities that must continue going, like the nuke facility in St. Francisville. They are still going to go to work. They have to. They have to keep that place running. However, within your wastewater facility managers, okay, just to make sure, and please remember, do not put anything other than toilet paper and the things that come out of your body in the toilet. Thank you. But, they have to go to work. They have to process those things. They have to keep those things moving. They also are having to practice appropriate social distancing methods. So they're running on skeleton crews. They're running crews at different hours of the night, and they are making sure that they're not having 10 or more people in any given area and making sure that all those people can stay 6 feet apart. They're also sanitizing those areas, disinfecting common surfaces, and they're having, alarms go off to make sure that people wash their hands. At least I hope that they are. The second level is those businesses that were closed by mandate to the public by the governor. And these are things like hair salons, sitting down at restaurants, entertainment venues, that kind of thing. You can see a full list on our website, www.livingstonparishnews.com/coronavirus. So these places are closed to the public. Now, that's the huge part about it, is this foot traffic in and out of your business. That is, the governor, and even for those that are in sort of a gray area, the governor is requesting that you close. That is the whole point of this, is that not letting the public come in and out of your business. Of course, it effectively closes retail as well. Now, these are guidelines. These are not necessarily enforced except for those entertainment venues we discussed as mandated by the governor. Now, you can still go to work as long as you practice those mitigation efforts and the social distancing. I mean, one of the things that the governor said himself is that even those entertainment venue businesses that were closed can still come in with that 10 or less crew practicing social distancing to clean, process payroll, do paperwork, that sort of thing, trying to keep that business going for as long as possible. So you can still go to work. Now, that's why a lot of folks are, now, when I say still go to work, it needs to be at a business where you're practicing washing your hands at least 20 seconds with soap and water, keeping 6 feet between you and everybody else, and disinfecting common surfaces. Those are really important if you're having to go to work. Now, a lot of folks are being allowed to work from home. Obviously, I am at home. This is a good thing to stay home, especially if you're sick. There's no need to go out except for this is part of the stay-at-home order. You can go to get groceries, you can go to the pharmacy, and you can go see a doctor. Now, they recommend telehealth for a doctor, which means getting on a camera and talking to the doctor. But please remember, the best path, if you are an employer, is to follow the stay-at-home order. Let folks who can work from home, pull in a skeleton crew if you absolutely have to keep the business running. But for the most part, let your folks work from home. Those of you who are working from home, Skyping, FaceTiming your clients, trying to get in front of those folks as best you can, but don't do it physically. Trying to keep distance between people. And the reason for all this is this, folks. A lot of people around here are saying, well, it doesn't affect us. Well, not yet. Again, the governor said that, and we'll have a story coming out later today, that the Baton Rouge area cases are trending right behind New Orleans. Of course, Baton Rouge is our neighbor. It is also where most of our critical healthcare infrastructure exists. So if Now, of course, the governor got a major disaster declaration from the president just yesterday. So hopefully federal funding as well as federal supplies will be coming through as quickly as possible. The problem with ventilators and masks is that everybody is competing for the same supply chains. They're being stressed. We have, New York is constantly growing in cases, California and Washington State. So we're competing with some really large states with some really big budgets in trying to get masks and ventilators here. If they do run out of out of ventilators on April 4th in New Orleans, you're looking at pretty soon after that critical healthcare infrastructure will fail. So you need to keep that in mind. This is why you're being asked to stay home, to work from home, only go out when it's essential, and please make sure to practice those mitigation efforts. Of course, Parish President Leighton Ricks said he expects the case number here in Livingston Parish to go up in the coming days. He also expects it to go up rapidly, maybe starting as early as next week. Louisiana Department of Health has been in contact with him. They might even open a testing center here in Livingston Parish to get a better idea of what's going on as more tests are created and sent out and purchased by the state. So please keep all those things in mind as you're moving forward and saying, well, how does it affect me? That's how. It's very hard to kind of see it right now, 3 inches in front of your face. But 2 weeks from now, it'll be interesting to see what happens on that April 12th date. So keep that in mind. PARDS, it's kind of interesting. PARDS parks are open to the public. Please maintain social distancing. Facilities are closed. So the grounds are open. So you can go run at the park. You can go walk. You can go out there and, I guess kick a soccer ball. Don't throw a baseball because you got to touch it with your hands. But, there's room out there to go roam, get out of your house. Just remember to practice appropriate social distancing and don't go all at once, please. There were some issues, of course, when the schools had to close due to the stay-at-home order with meal deliveries. 14,000 meals were handed out a week ago Wednesday. And then the stay-at-home order came and the schools had to close their campuses. Well, Director of Child Nutrition Summer Purvis said that just wasn't good enough. So she, as well as several other workers and her husband, Jody, who is an assistant superintendent, put together 6,000 what are called shelf-ready meals, which doesn't necessarily mean that they're non-perishable, but it means that they will be, you can refrigerate them, roll them out, and they went and handed those out directly, or are going to be handing those out directly over the next couple of days. This is the plan that they have going forward, trying to practice appropriate social distancing during that time, but they want to try to keep as many of these kids fed during this time of closure. Of course, the stay-at-home order lasts till April 12th. Based on the April 4th and 7th dates in New Orleans, probably have a better idea of whether or not then that this stay-at-home order will be lifted. So please remember that staying at home, practicing social distancing, if you have to go out, only going for the essentials, staying home as much as possible, and staying home especially if you're sick and getting on the phone with your doctor are the absolute best things you can do to try to flatten the curve on this thing, trying to spread out the amount of people who have to go to the hospital at any given time. To receive intensive care, because if you hit the pneumonia portion of this, you will have to be ventilated or intubated, whether, and it's not good. And remember, they are critically behind on ventilators. They're trying to get more supply in. That would be the state of Louisiana Department of Health. And right now, everybody is competing for that same supply, and that is the problem. One last time with your traffic, of course, minor delays at 4-H Club Road and River Road and 190 and Denham Springs, as well as some delays at 190 and Juban. It's currently 68 degrees. 88 degrees is your high. It's going to be a sunny day today, but it is going to be hot. 68 degrees is your overnight low coming up. One last time, my name is McHugh David, publisher and editor of the news. Appreciate you guys joining us this morning for the Livingston Parish News Morning Show. Please try to remember those guidelines for going to work. Try to work from home. If you are a business owner and you got to bring people in for work, keep the numbers low or work in shifts. Do the best you can. And also remember the mitigation, washing your hands for 20 seconds, staying home, especially if sick. disinfecting common surfaces in the home or office, 10 or less gatherings, and staying 6 feet apart. Remember, if you are a business, you're trying to stay close to the public, keeping that foot traffic low, letting folks work from home, trying to communicate with people digitally. We are on Facebook, Twitter, LinkedIn, Instagram, and YouTube. We are once a week in print on Thursdays. Please remember your paper is just fine. Currently, the United States Postal Service is practicing new logistics and new sanitation methods within their mailroom to make sure that they're not delivering the coronavirus to you. However, we did hear that, as in other states, they are losing folks to the coronavirus. And of course, they are staying home. But that unfortunately means that if this thing hits the postal system, mail may stop. We had reported that as of right now, mail will continue, and it will for the time being. They're saying it might be summertime before they don't have enough logistics or enough people to perform the delivery of mail. We also online, www.livingstonparishnews.com/coronavirus. Please remember that all those articles are free. We're trying to keep the public informed as to what's going on with the coronavirus, especially with regard to the state and Livingston Parish. We hope you have a great day. Please stay safe. Please practice the mitigation efforts. Please practice social distancing. We want to flatten that curve and we want to get through this. We don't want that April 4th date of ventilators running out and that April 7th date of healthcare collapse in New Orleans to occur. We want to flatten this curve. We want to give those people in New Orleans some relief, especially so that it will not happen here. Hope you have a great day. We will see you tomorrow morning.